ClearSK lover, it's me again. I'm Dr. Shiau Ee Leng. Today the topic that I'll be touching on will be on acne and acne scarring. To me, acne scars is not just a skin condition that my patient have, but it comes with a lot of emotional connotations, because a lot of them will share with me how traumatized they felt when they developed rather bad acne and scarring, and how it affects their self-esteem, their social life because they don't dare to go out and meet up with their friends, how much teasing they experience because of the scars on their face that give them funny nicknames like pockmark. So therefore, I realized it's very important that we treat acne scars early and sufficiently to give good results. For this acne scar known as Post-Inflammatory Erythema, so these are small little reddish kind of marks that appears on the skin after acne has gone off. Typically, you can just leave it alone and it should go away within 3 to 6 months. For some people, they can apply skincare at home that contains niacinamide, vitamin C, retinoids, adaptogene to slowly reduce the inflammation. Products containing hydrocortisone can also be used with guidance from doctors. Nowadays, lasers is actually a very useful modality for treatment. Laser targeting all these reddish microvasculature will help to reduce the redness of the marks, and actually treatments can achieve rather good results after say about 4 to 5 sessions done at 2 to 4 weekly interval. Okay, so for post-inflammatory hyperpigmentation, it is actually a brownish circular mask on the face after acne has gone off. This is due to melanin deposits on the skin. It's typically very common in darker skinned individuals. It can recover by itself after 3 to 6 months, while for some select individual with poor cell recovery, it tends to last many years even. So the main treatment is to exfoliate to cause increased cell turnover. Home care products that you can use consist of niacinamide, vitamin C, adaptogene, retinoids, just to name a few. Okay, for more information, please refer to the playlist at this corner. Okay, so some people have post-inflammatory hypopigmentation. So this is due to damage to the cells causing loss of melanocytes, resulting in a very uneven skin tone after acne. Most importantly, please stop any cream containing benzoyl peroxide or cortisone that can cause hypopigmentation. Lastly, I'll talk about the hypertrophic acne scars. So these are the scars that tend to be red color, raised, very hard. It can occur in specific parts of the face. Specifically, it's actually the jawline. Sometimes it can extend out to the neck and the shoulder area. This hypertrophy or keloid scars typically is due to an unknown reason that trigger off the formation of excessive scar tissues. So the treatment are typically require injection. So we can inject steroids known as triamcinolone into the scars to slowly shrink these overgrowth tissues. Sometimes silicone sheets can be applied onto the scar tissue to press on it to slow down the overgrowth. A small group of people may benefit from surgery, although surgery has been known to worsen the scar by more than 50%. So I would say a combination treatment is probably the best. It means combining surgery with injection if necessary. The good news is recently Rejuvenating has been used by scientists, and some studies are underway to show that it might have some effect to reduce keloid formation. So we will wait for better results. So in conclusion, acne scars is best managed as a prevention. That means treat acne early so that the scars will not happen. But if scars has happened, seek treatment early, because you actually need much fewer sessions of whether it's lasers or filler injection to get the best results. For instance, we do have Aqua Peel, which I personally liked it because it's a Korean technology that uses a spiral tip to exfoliate the clogged pores at the same time as using a combination of acid cocktail like salicylic acid, lactic acid to reduce the oil production of the skin. At the same time, the exfoliation actually lightens out the superficial marks. I hope this helps. Thank you for your attention. I hope you find today's video really useful to you. So please put any comments or any questions you have on our comment site so that I can answer them. Remember to like and subscribe, okay? See you guys. Actually, we cannot mention this, but off the record, I do see quite good results for people with quite bad keloid scar. So what I did is I actually inject the steroids onto the scars, and after a few sessions when the scar is flattened out, then I put in a bit of the Rejuvan onto it, and I do have rather decent results. So I'm going to try with some of my patients who are with me for many years, and they are very willing to be a study group to learn this together. Yeah, so off the record, okay?